everyone. This is our live session with Dr. Jeff, and we're gonna join with Dr. Jeff, and you can ask all your questions. Let me see. Hi, everyone. This is our live session with Dr. Jeff. As every Thursday, ask your questions. Hi, Doctor. How are you?
Good. How are you doing?
Good. Doctor, so thank you everyone for joining. This is our live session with Dr. Jeff, and I'm going to start with Miss Irizarry. How do you get rid of hip dips and dents in buttocks?
So that's a great question, right? So we do that by transferring fat to those kind of indentations. That's
Mm-hmm.
actually very important to correct to get the shape we want, right? We talk about reversing the curve, right? So we want to take the fat from the flank area, from the waist area, remove that, and transfer a portion of it. You don't need a huge amount to give really nice hip fullness, but that's how you correct the hip dips or the depressions, the concave shapes on the side of the hips. So that's a really nice improvement. But then the question is indentations or things like that in the buttock region, right? So
Mm-hmm.
some are correctable, some are not as easily correctable.
Oh,
Okay, so usually
good to know.
the hips don't really have, in my experience, a very significant amount of attachments. So the skin really wants to kind of expand more readily than areas of the buttock region where you can have, fibrous attachments kind of pull back. And in certain cases, we may use different types of instruments to kind of break those up. But in general, there may be attachments holding that down. So sometimes we break that up. Sometimes it just doesn't want to expand, and sometimes it's very tight. And sometimes people use the term chicken butt. If you know, I can't remember a picture of that, but it's kind of on the inside where there's kind of like these little tight areas down low on the inside, and they kind of
Let
look
me
like
see.
they're pinched. Maybe you could pull one up. I mean, they
I
kind of
think
look like they're pinched, and basically those I can show you, patient photos, but basically those areas similarly are sometimes very tight, and there's not a lot of skin to expand, and the skin that's there is kind of very, very tightly bound. So we try to, release that and expand that. So overall, you can get a significant improvement of all of these areas, but people also talk about cellulite and things like that. And these are scenarios where you have little fibrous bands that are pulling down the skin or causing depressions. Some of those are correctable, but like I tell people all the time, we're not using, it's not like an ironing board, right? So we can't just iron out these irregularities. But usually a lot of them are improved, if not all of them, but it just varies. So these are just things to keep in mind.
I think I put an example that I'm gonna show you right here. Hold on. Well,
Yeah, a little bit like that. Like right, you can't see me pointing, right? Maybe you can. Like I can't really point right there. But on the inside, there's that real tightness, and we strive to improve that. And there are others that are just more kind of depressed, like depressions medially. But nothing to worry about. Usually we get those to elevate and to give a nice contour. But there are different things to keep in mind when we're doing each of these different contour improvements with fat transfer. That's a great question.
yeah, that was a great question. And another of the questions that I have here from the patients, it's is it okay to keep my drains in past 2 weeks, and when can I get a massage on my tummy? So these are two questions from
Okay,
It's Now
so
Money.
typically no. So the first one would be really no, and the second one would be really never. All right. So the first one in the sense that we want to keep the drains for 2 weeks. All right. So there's no reason to keep them much longer than that. Most people, want to get rid of them. So I keep them for 2 weeks because I want the suction to help keep the flap down and also to alleviate any drainage that accumulates, of course. So 2 weeks usually suffices. If you feel there's a little extra drainage, you want to keep them an extra day or two, that's certainly fine. But I wouldn't go beyond that because this is a foreign body, remember, and you have an increased risk of infection,
Absolutely. Yeah.
right? So I definitely want to get those out at 2 weeks, preferably. Maybe one day sooner, but not more than that. So usually it's around 14 days, all right? And the second part of that question, Could you go to that again? The second part of the
The
question
second
was
part was like, when can I get massages on my
right.
tummy?
So that's why I said
Assuming that she had a tummy tuck.
right. Assume if she didn't have a tummy tuck, you get them right now, right? But the assumption she's talking about drain, she had a tummy tuck, and basically we don't want anyone touching that belly, the front of the belly where the flap is, for at least 6 to 8 weeks. The flanks you could do the same time, the next day, because that's not going to compromise the flap. But if you have somebody who's pressing on the flap even gently, there's just no reason at all to worry about the swelling in the flap. The garment, the binder is going to help with that. And then 2 weeks later, when the drains come out, we're going to go to a faja, a regular compression garment.
Mhm.
So those things and time will alleviate all the swelling and edema. But pressing on it as a massage, we don't want to do that because you can kill the flap. All right. So, I mean, to be very blunt about it, you could kill the flap and end up with a black, necrotic, flap that has to be partially removed. So we don't want anybody massaging. Don't worry about the flap. Don't touch it. Don't worry about it. Let the swelling resolve on its own or with the garment. All right. All the other areas, the arms, the thighs, and all the other parts can be addressed, but not the flap that we elevate.
And hi, Jazuzui Gia. She's saying, Dr. Jeff did my Lipo 360 and J Plasma. I look amazing.
Oh,
Huge
I'm glad to hear it.
transformation.
Oh, it's great. Great. I'm glad to hear that.
All thing, summer. She had a tummy tuck in February. She wants also like a consultation with you about
Sure.
the results.
Sure. Just come on in or give
Uh,
us a shout.
yeah. Hold on, and let me just check more of the questions that we have here. Um, um, okay, it's not money. Hey, had my combo May 13 and was his first of the day. Love my results.
I'm glad to hear that.
Jada Martinique, our post-op meds included in the price. I booked with a promo and I want more details. No, they're not included. You have to you can, I mean, if you have insurance, maybe you can get them through your insurance. We do have a package that you can actually purchase. In that case, you don't have to go to the pharmacy, but no, you have to pay for them. Let me see more questions here. Christy Otaku, what are the best ways to recover, or what to recover a combo procedure like a tummy tuck and BBL?
Yep, that's a great question. So we get asked that all the time. So you want to protect both areas, right? So with the tummy tuck, you're going to be wearing the binder, then go into the compression garment, and then with the BBL that as well. But typically, people are asking like, how do you go to sleep, or how do you get into the bed? Basically, with the tummy tuck, you always want to be at about 45 degrees, so slightly flexed,
Yeah.
right, to take the tension off that tummy tuck incision, right? And then with the BBL, you want to be off of that area using the BBL pillow. So it's a little bit awkward at first, but people get used to it pretty quickly. You definitely want to
Mhm.
protect both areas. And no, with the BBL tummy tuck, you do not want to lay flat on your belly to protect the BBL because that will destroy the tummy tuck, right? That will tear everything we've done. So you want to be on your back at 45 degrees and use the BBL pillow at the same time.
Okay, beautiful. And he did mine. Okay. So for the questions about the giveaway tomorrow, it's going to be around 3 p.m. My recommendation, activate the notifications for that tomorrow. And I'm happy that you're on top of that. The question is about the giveaway. Christy, okay, Nancy Book, coffee lovers. Is caffeine okay before and after surgery? How much is too much? This is a very good question.
Yeah, probably. I'd say anything is too much initially. We want to hold off. It's probably a week before, or at least a few days before. Okay, because that
Mm.
raises your heart rate, right? Everybody knows the effects of caffeine, of drinking coffee or of soda, things like that. So things that are high in caffeine get you a little bit hyper, right? That's why people, they use it to motivate them to get through the day, that sort of thing. But we don't really want your heart racing. We don't really want it to increase your blood pressure. Caffeine also makes you pee, right? So we don't want you to be dehydrated after surgery. So yeah, so I would hold off for like 3 to 7 days before and after surgery if you can survive. If you can't, then at least 48 hours before and after. We just don't want you to have, first of all, you can't drink anything before the day of surgery, right? But the day before, 2 days before, we still want you to hold off. You drink plenty of other things, but I would hold off on coffee and caffeine products for at least 48 hours before and after, because we don't want the physiologic effects of the caffeine to potentially play a role in the anesthesia and so forth, right? We're dealing, this is all about physiology when it comes to anesthesia. So we don't want anything messing with that. So, yep, I'd avoid the caffeine for at least 48 hours or more if you can, before and after.
Wow, thank you, doctor. And Coach Nelly, she's in love with her results, she's saying.
That's
And
great.
also, she's 3 weeks post-op with Dr. Jeff BBL. How long do I wear boards for?
Oh, so people know that I don't require people to wear boards, or I've honestly never loved boards. I think it's fine to use them. You've got your boards, then you've got your foams, right? And then you've got just your garment. So a well-fitted, snug garment where you can put two fingers in is all you really need. That and patience, all right. But if you want to do foams, that's certainly fine. On the flanks and different areas, they just make those areas tighter, right? So that's all they're
Mhm.
doing. But there's some compressibility to the foams, right? Once you go to boards, um, they're typically not compressible, right? So now you've got a hard object against your body and the garment is holding it in place. And that can be perfectly fine, but you probably don't want to sleep on that because that could cause, pressure on those areas where the boards are non-compliant. Your mattress is
Mhm.
compliant, your garment and the foams, those are all compliant, they're compressible. So for me, I would I would hold off on boards, certainly when you go into bed. There's just no reason to sleep with those. And otherwise, they're fine, but if you find that they're leaving marks, I would avoid them. If you find that they're leaving indentations, I would avoid them. But other than that, they're fine. I'm not sure I addressed the question specifically, but as far as when they're required, I don't require boards for sure. I don't require foams either, but you're certainly welcome to use them. But what I do like is to have a garment that fits well, right? And then you're going to have to go in your course to 2 or 3 garments. And I've never had a patient complain that now they need a smaller garment and then a smaller garment, so that's never really a problem. But that's something to anticipate.
I have Anne Fan Pigs saying like yes to everything that you said, and she
Oh, I
said,
appreciate that.
"I'm not a fan of anything but a faja."
Yep. No, I really do agree. I really do agree. And I could, go with the foams. I don't really like the boards because you don't really need them. You just need to be
Mhm.
patient, and they could cause harm, right? The garment will never cause harm, all right,
Mhm.
or it should never cause harm, right? If it's properly fitted.
Yeah. I
Um,
remember when I had my own experience when what I like to about using the boards, it was just one board on front because I was working on my computer and I felt like, my position normally tends to do this. So I was kind of like creating those, you know, like, um, folding this area. So and I was
right,
within still the 4 weeks recovery
right.
after the lipo 360. So that's when I use them because it was
That makes
helping
sense.
me to have like a different
Right.
position.
But we just need our patients to have better posture, right? So if you're sitting up like this instead of slouching, if you're a sloucher, then I guess you're going to need it so it stays in front and it holds you up. But if you could just sit upright, and not be a sloucher, you wouldn't need that pressing on you. So, and certainly, those foams and boards should never be used for a tummy tuck, obviously, right? So we've got the garment, which is great. No foams or boards on the belly, no massaging, none of that stuff on the abdominal flap.
Correct. And Coach Nelly said, yes, thank you, exclamation. I hate them. So reassuring.
All right, great.
And Anne from Pigs, she says, the patient needs patience.
It's true.
She's
Patients
laughing.
need patience. Absolutely. I
When
always
do
say
you
that.
like, oh, okay, and this is Coach Nelly. When do you like to tell your patients what is okay to start sitting down?
After a tummy tuck or after what? Oh, you mean after a BBL, probably, right? So typically, I wait like a solid 6 weeks. All right, so I really want to protect that area. And actually, let me take that back. You could sit down today using the BBL pillow. right? But obviously she means without the pillow, right? So typically I'd say 6 to 8 weeks, all right, would really be a safe time frame. It's a hassle using that, I know that, but people get used to it.
Yeah. And come on, it's not gonna be forever.
Not forever. It just seems like forever.
Yeah. Shaki Jones 2025. I'm scheduled for a tummy tuck and back lipo. Can we squeeze in neck and chin lipo for the same day?
Oh yeah, of course, that's easy. You can just
Hmm.
add that on. That's simple.
Yeah, you just add it on. And then go to BBL. Do you have any recommendations for a BBL pillow? Amazon.
Oh, I mean, there are many. There are
Hmm.
many, and I don't really have a specific company that I prefer in general. So I think that they can speak with our coordinators or our people upstairs. I think we have some here as well.
Yeah,
So yeah, I haven't looked at the brands of those in quite a while, so I wouldn't want to give out, a name
yeah,
for that. But many, many are designed very well these days. So
yeah.
they provide the support you need, and they're comfortable because basically they're going underneath, the bottom of your thighs, underneath the thighs, and the nice hamstring muscles are resting on them. So those nice strong muscles are supporting the weight of your body while decompressing the BBL area. So, but there are a number of them that would do that well. I do. I can
Okay,
hear you.
great. One more question here. Vaser versus regular lipo difference plus who is a candidate, BMI, etc.
Well, it really varies, patient to patient, surgeon to surgeon. Vase is really a vibration